Afternoon. It is still January 15th, 2025, Wednesday, and it is about 3:30, and we are on our last for the day testimony from the our Agency of Human Services, and we're delighted to welcome Dr. Levine and Paul Daly. And we have many new members on the committee, so I thought we'd start by introducing ourselves, and then you all can introduce yourselves for the record and take it away.
Good afternoon, Dave Iacoboni. I represent the Lamoille, Washington District. Good to see you.
Yep, good afternoon, welcome. John Kosenska from the Essex Caledonia District, and I'm from the town of Burke.
Mike Nigro, Bennington and Mount. Tom Stevens, Waterbury, representing Washington, Chittenden.
Good afternoon, Jim Harrison, Rutland 11, Chittenden, the other Chittenden, Mendon, Killington, and Pittsfield. So welcome.
Robin Chai from Middlebury. Jeff Brumley from Burlington.
Trevor Squirrel, Underhill and Jericho.
Wayne LaRush, Franklin 5, Highgate, Franklin, Berkshire, Richford.
Hi, Mike Verwicki, Wyndham 4 District, Putney Dummerston. Good to see you.
Hi, Lynn Dickinson. I live in St. Albans, represent St. Albans Town.
Introduce yourselves and you're on.
Thank you. Good afternoon. My name is Mark Levine and I'm Commissioner of Health, and I'm joined by
Paul Daly, Financial Director at the Health Department.
Thanks for inviting us and accommodating the time we needed to testify on the governor's fiscal year 2025 budget adjustment recommendations for our department. I see all these colorful pages that are in front of everyone. So we will be referring to those because we have not prepared a slide set for the few changes that are in our budget. Pages 9 and 10 of the AHS ups and downs that were provided to your committee today should be the sweet spot for what you need. Whenever you hear about the Department of Health budget, we always have the same 3 appropriations: administration and support, public health, and substance use. So going through those in that order. Well, starting with administration and support. The administration is requesting additional funding for the cost of the health department's share of the service level agreement with the Agency of Digital Services. Total of $646,940. B.311 is the line. Is the difference between what was budgeted in the fiscal year 2025 budget as passed and the total annual cost.
So
I'm probably hearing that from other.
we are, and we're very interested but we do know that that first 120 was the money that was reallocated from the central office. And then the second is the increase that ADS has told you that they have for you for the rest of the year. What prompted the 202 for this 405 increase?
Madam Chair, the negotiations for the service level agreement are done at the agency central office level. This represents our share. So it represents what the central office of AHS and ADS determined was the total cost, and then what our share of it is. And so what you see here is what Rich Donahue referred to earlier today. Part of this was money that the agency held at the central office in anticipation of the final resolution of the allocation. And part of this is new money that was not originally budgeted.
Okay, and we don't know why why the new money was necessary, but that's an ADS question.
I think that I'm not sure how Rich, I don't want to speak for Rich, but I think that you're usually working with trailing year costs. So these are costs that were already in the books, and it was just, they settled up the books and they said, this is what we need from AHS. The 2 agencies worked, understood, what the documentation of it was. And then in Rich's office, at central office, they've made the allocation based on, sometimes the costs are based on head count, sometimes they're based on the level of activity on servers and things like that.
Yeah, question.
Yes, just so that I understand that, because that's a slightly different thing that we've heard, not that it's at odds with anything we've heard, it's just a little different. So so you said it was trailing, so these are for services already rendered that the department has done an audit of sorts and said that this is what it costs, rather, this is what it did cost as opposed to this is what it will cost. Is that?
I'm gonna look to Rich, make sure I'm stating that correctly.
Please.
Yeah, Rich Donahue, CFO. This is a true up of the 2025 billings that you received from AES. And we, as Paul Daly described, we in the Secretary's office determined that each department's share of those total AHS-wide costs, and then we prorate those costs to the departments. And that is the process that Paul Daly was describing. The underlying services charged are for the final 2025 billings that ABS anticipates for the agency. And we had a certain amount of funding in our base budget as an agency. These entries for BAA is asking for a difference in appropriations needed between what's in our base and what the final 2025 billings were provided to us by ABS.
Okay, so did I hear that AHS receives a bill
Yes,
and then you go through each of the divisions and say that the Vermont Department of Health represents 32% of our budget, therefore they carry 32% of this extra bill or of these services?
as an example of how that logic would work, that's correct.
Okay, and then in this ask for a true up, or not more than, it's more than a true up, there's 405 and then 241. And one of those numbers is unanticipated costs.
Well, of the two numbers, one's a reallocation of what was built into our budget this year, correct? The second number is in aggregate, the agency $3.2 million additional bill appropriation requested in this whole agency. For the final build costs that ABS provided to us for 2025 services. And as an example of those services, Microsoft Enterprise Licensing would be an example. So where there's an increased cost in Microsoft licensing, for example, we would be billed that increase by ABS, and then we distribute those charges across the departments.
Okay, that's as much as my head can handle right now, so.
And if I may, I believe Chair Shadi, you said earlier that ABS would be coming in this week.
Yes.
They can probably provide more information.
Yes.
In terms of how the actual statewide billing process works for what services.
Right. We will learn a lot more. But thank you. Thank you for that. You can see we've had some questions about ABS.
I won't go there.
Onward.
I will now move to the Public Health Appropriation, Section B 312. The administration is requesting $100,000 general fund for a grant to Planned Parenthood of Northern New England for women's healthcare medications. This will support the purchase of a one-year stock of two medications used for medical abortions, mifepristone and misoprostol, which will help assure uninterrupted access to care for patients. It's intended to be a one-time assistance in response to uncertainty in the regulatory environment.
Thank you. Rep. Harrison?
Seen various reports out there that suggest the other states that they cover do not help with state appropriation. I don't know if that's true or not true. My more specific question is this for Vermont, or is this also helping their clinics in New Hampshire?
I'm 100% sure it's being used, if it's being used outside of Vermont.
I could answer that if Representative Harrison. 2 years ago, a similar situation arose, and the the state told Planned Parenthood they could use it across their service area because they basically put it in their routine inventory management. This would be specifically for services provided in Vermont clinics, and it would be limited only to that.
Okay, so there is bumper guards on this. This is for, I have nothing against the organization and what they're trying to do. Or I just don't think Vermont taxpayers should be paying for services they're providing in New Hampshire. New Hampshire taxpayers should be paying that, especially when we're the smallest state out there.
Sounds like that's the case.
Okay,
Yes.
So along that same lines, if a patient comes from out of state to receive that service, this would pay for that too. First of all, can patients come from out of state and get the services at Planned Parenthood? And then if they do come,
I believe so.
would this pay for that?
If they come to this state.
So we could be paying for chemicals and drugs for people coming from out of state where they might not have the same legal opportunities, and we're paying for it.
I don't believe they would differentiate the use of this inventory that we're providing.
Yeah, sure.
So to rephrase it a little bit, $100,000 is for the clinics in Vermont to service whoever
Yes.
comes through the door in the clinics in the state of Vermont.
Right. And do we, I know that many other states are doing this. Do you have a sense of how many other states are doing this sort of thing? Or
I do not.
I just,
I mean,
I can't go reading, so.
I know, since I network with innumerable other state health officials,
Yeah.
that some states have no concerns, but many states have concerns. Many states that are like Vermont have concerns.
Yes, yeah. Great. Any other questions on this? Okay, let's continue then. Thank you.
We'll now move to the Substance Use Programs Appropriation, P313. Requesting just over $1 million of additional funding for substance misuse prevention programming. So if you look at current law, 30% of the year-end balance in the Cannabis Regulation Fund shall be allocated for substance misuse prevention activities. When the fiscal year 2025 budget was passed, it included $3 million in the substance use appropriations for this purpose. The fiscal 2024 year-end transfer was greater than estimated, and the 30% earmark for substance misuse programs totaled $4,025,125. We will use this additional funding to continue the expansion of long-term, statewide, school and community level evidence-based strategies to prevent substance misuse by providing education, positive alternatives, policy changes, community support, and early identification of problems and referrals to services. These kinds of prevention programs work to help Vermonters of all ages lead healthy lives. The General Assembly actually had a very far-sighted decision to dedicate a portion of the cannabis tax revenue to prevent substance misuse. And this will give us the chance to take these proven prevention strategies to a statewide level and scale them up and sustain them for the time needed to ensure success. All of the programs that currently exist, always the problem is scalability to a statewide level and sustaining them. Beginning in fiscal year 2026, the law directs 30% of cannabis excise tax revenue for substance misuse prevention programming up to a maximum of $10 million annually. We have plans that are in place to continue to provide and expand prevention programming to that level as the revenue allows.
Yeah, I just wanted some clarification. Then this additional $1 million will be spent within the next 5.5 months? Or will it roll over?
I can see it being spent right now with the structures that we have in place for substance misuse prevention programming at both the community and school levels.
If I could, Representative Bloom, I would qualify that. We would expect to obligate those funds through grant awards. Actually, but the grant awards they're operated on a reimbursement basis. So we would expect that some of the payments for the new awards would be made after the end of fiscal year 25, and the funds would be carried forward into 26 for that purpose. But we do expect to be able to commit all the funds within as soon as we have action from the legislature.
Other questions? Yes, sir.
Back in the sixties, we had a big program about don't smoke, not smoking. Still, I think your agency still has ads on television about anti-smoking vaping. I don't see the same kind of programming about don't do drugs. Do you have any thoughts on whether or not there's a need for that, or whether or not it would be effective?
We have abundant programming that may not be connecting with you. Depends on what media you're following, what age you are, and how targeted the programming is to certain demographic groups.
I'm talking about, we see on TV. Ads on TV all the time. We don't see, I don't see ads about don't do drugs, but I see plenty about cigarettes and vaping. Am I just looking in the wrong place?
Yeah, to some degree. You're not our prime demographic. That being adolescent and young adult years are the prime demographic. Social media is the prime tool, to be quite honest, and is abundant messaging campaigns that are on there.
So you're working on that. Okay.
It's not even new. It's been going on for all these years.
I guess I'm watching the wrong media. I should look at it.
Well, no, there's no way you would be even alerted to some of this, because you're not connected to the same social media that the youth are. But again, there will be some things on media that you actually see, but not to the extent.
Gambling. Gambling. Don't look at me. I'm Let's see.
Brett Bloomley.
I remember in conversations that were held in Human Services last year, there were questions about whether there had been any kind of evaluation of the programs that exist right now. And if so, I think that all of you are my contact, is that right? Would I be able to see that sometime? If that exists, because I just want to make sure that in my conversations with them, we're.
Yeah, no, we got this request at Senate Appropriations last year as well.
Okay.
So there's a number of data briefs that we have in our department that.
That'd be great. It'd be nice to know how it's specifically impacting and the numbers of people and all that kind of stuff.
Yeah. And though messaging is a component of all this, some of the programming we're talking about with this appropriation is prevention program consortium, if you will, across the state. We'll hear terms like prevention lead organizations. We have the state carved into several pieces with a hierarchy of administration and programming that goes down to the community level, as well as separate set of programming that's actually in the school systems. Human people actually connecting with youth, as well as other types of curricular involvement. So most of this money is not really messaging bucket as much as it is the actual helping youth make the right choices and providing the right choices in communities.
I realize that, and I know I was painting a little bit out of balance in terms of the budget adjustment. Excuse me for that.
No, but I think you are right. What you see on TV is much more tobacco directed, quite clearly.
Rep. Dickinson?
Yeah, thank you. Can I go back to the public health piece? We have got, we have had vaccinations that we worked really hard, that you worked really hard at for
Mhm.
COVID and a variety of other things. And vaccines are under attack, I guess, potentially under attack. And there's declines in the number of students that have it. I think it was used to be the herd protection was something like 95 or 98% for schools, and I just read somewhere recently that it's gone down below that.
So,
You don't have anything in here. I mean, is this something that what we've done is
no,
adequate?
there's nothing in here because this
No.
is budget adjustment.
Right.
But we've had it all
So-
along.
Yes,
So,
there's still plenty of money going into immunization program. We can send you I think it's in a data brief form, how Vermont's experience has been with vaccines in general at school age level, because you're right, what you're reading in all of the media is decreases in rates. Aggregate wise, we actually are one of the states that is not suffering as much as many other states. We have data to support that. I will point out that a lot of vaccination hesitancy and resistance is at the micro level. So you can have a state number that looks really good, but you can have pockets of communities or portions of communities across the state where the number is way low, like not 95%, but 40%, making them still vulnerable, even though they are located in a state that has a great 95% rate. So that's what we worry about the most in immunization these days is those, whether they're communities that are defined by, just choice or by ethnicity or by education. Communities that have chosen not to have a robust vaccination, more exemptions to getting a vaccine than others. So that's an important focus Vermont-wide and nationwide right now.
that will be something we'll see in the 26th budget in a few weeks. Or somewhere in there will be part of the public health budget.
You'll see immunizations in the budget. Yeah, I can't tell you exactly what you see.
Sure, thank you.
Yeah. Great, thanks. Any other questions for Dr. Levine and Paul? Great.
We have a few other.
You have a few other things.
Yes. So there were several one-time appropriations related to the health department budget in the governor's recommended APA. So I'm going to refer here to the fiscal year 2025 BAA language provided.
Oh, sorry.
Just so members know, you're not gonna find it in the ups and downs.
Right, that's.
You're gonna find it in yesterday's.
From the Commissioner of Finance and Budget.
Yes.
Yes, that's what I would.
No.
I'll make it today or get there.
Yes, so section 49 on page 32.
Yeah.
So you can also look in the language, you can find this in two places, in the language, section 49, page 32. Or 49, anyway. Or on that other spreadsheet that we got from Adam.
Right. Shall I give you a moment or you?
So you said page 32? 40?
32 of the budget language
Budget language.
held up.
Yeah.
And I'm not, and no one could point this towards section 49 on the spreadsheet format.
Right, okay, so this isn't the 11.
It's in the B1100, yes, ma'am.
Yep.
Yes, at the top of page 32. Okay.
All right.
You shall.
Okay. So first item, an increase of $150,000 general fund for the legislatively directed household health insurance survey. Our department contracts for this survey through competitive bidding, and the final cost is $550,000.
And you do that ideally, we're doing it every 3 years, and it's been more than that, right? Yeah. So we needed to do it.
2021 was the last.
Okay.
Go to the next item then. A one-time appropriation of $500,000 GF for community grants related to health equity. And you had a presentation from Deputy Finance Commissioner Merrill that explained the reason. In a prior year budget, the General Assembly appropriated base funding in Office of Health Equity, along with one-time funding for community grants to the Agency of Administration. But the administration has opted to establish the Office of Health Equity and the Health Department. So the budget adjustment language here just transfers the one-time appropriation for community grants to the Health Department, where we will administer them.
So this is not new general fund money. This is simply transferring it from one department to another.
That's true.
Correct. Yeah, okay.
That was my understanding, but why is this 500,000 underlined? Is it taken
Because
off?
it's going to the Department of Health.
Yeah, I know, but is it? I'd have to look through, see if it's deleted somewhere.
If you go to the explanation, which is
The next.
on page 33, it clarifies that exactly what happened.
Okay.
Yeah.
Thank you.
The last item we have is $4 million general fund for contingent sustainability grants to mental health and substance use residential treatment facilities. I believe Secretary Samuelson addressed this request when she had provided her testimony just a couple of hours ago. We are aware of some mental health and substance use residential treatment providers experiencing financial instability that could potentially affect their ability to care for patients. The request for this contingency funding will give the state the flexibility to provide time-limited financial assistance as part of an overall organizational financial stability plan. Alternatively, the funding would be available to secure services from other providers if that's necessary.
Do care places that are struggling. We just heard from Dale also, so it's statewide.
It's a little bit of a theme.
Yes, it is a theme. Is this one yours?
Well, I think so because of the mental health.
Yeah.
Substance use.
Yeah.
Yes.
I mean, would this be in B 313 or 14 or?
Well, it's in one time, so, but probably. it would
Oh,
be
yeah, right,
related
one
to-
time, forget
It would be
Never
related
mind.
to.
Yeah, okay. Can I ask a question? What, I'm sure that it's really unnerving to see, institutions upon which we rely in real financial duress. And I'm just wondering how do we, maybe this will be part of your budget presentation, but how do we, there are themes throughout about kind of the structural integrity, right, of the system that we have. And we have no idea what kind of surplus we're going to have next year. And the budget presentation that the presentations we've had today have been very unnerving because of the amount of money which we may not have next year. And so I'm just wondering what work we may be doing to meet the real need and understand the systemic pressures well enough to know where to put the money, I don't know.
You will hear a lot more about this in the 2026 presentation.
So people are thinking about it, which is what we should.
We've been very thoughtful about it. Yeah. And the tension you
Yeah.
discussing is very real.
Yes, it's scary, yeah.
Not scary, just real.
Well, to think about the future of it, if we don't have, this year we were lucky, as Tiff said, we have
Yeah.
excess revenue. There have been years when we've been 150 million short coming into this adjustment.
And I guess I would just also qualify, like, the request today is for what we might term extraordinary financial relief. But that doesn't mean there aren't organizations that have no requirement for that relief and are operating just fine in the current environment. So I don't want us to be, our perception to be colored by the fact we do know there are some places that are vulnerable, but there are others in that same niche that are doing just fine. So it's not systemic wide that everyone is failing and the state needs to come in on the right horse and ensure everybody.
That's a good reminder. Reverend Ricky?
In a similar vein, I just want to hold up that concern. It seems to be the monster under the bed that we really don't know. And it's not just in this area. I mean, it's across, there's 180. Just for the committee, it's certainly something, and not just AHS, but across to look at. These are not sustainable.
Right, we have many challenges to be addressing. Yeah. And we're glad you're addressing these.
We'll be eager to talk with you more.
Were those the last of your, okay, I want to be sure. Any other questions for Dr. Lena Paul? Okay, thank you so much for coming in. We'll look forward to seeing you after the budget address. Hearing more about what's coming up. So, and folks, check with Tiff if there's questions for, I think most of that.
That's the committee.
Not the, sorry, committee members, if you have questions.
I have
the 11.
11 through 12.
And Tiff is 313.
I have 300 to 305 for the HS.
So everybody's committee, our whole committee portfolios are all up on the website now. It's right on the front page down on the left. So if you're not sure who has what, it's there. And as you're seeing, you'll have the B number, sort of the launching spot, and then equivalent one-time money that's the same in the same area like we just heard today would still be yours. And then the language part in section E that refers back to the B section. It's the same letter. So we'll get into more of that when we get the budget, but that's it. So thank you very much.
Thank you.
Appreciate you.
Good to see you both.
Committee, our agenda is a little different for tomorrow. This is how things change. Flexibility. Do I have the most up to date, Erin, if I refresh my page? Yes. 3:17 p.m. is the last time. Okay. So we're meeting at 9 tomorrow. Not at 9:45. Sorry, you can't sleep in. Department of Liquor and Lottery is going to be 9. And then we'll do Vermont Health Access and Mental Health, BCF, et cetera. And then we have Agency of Digital Services is now coming in tomorrow afternoon at 3:15. So, yeah, no. Until 4:15. Yes. They moved. And we're having them tomorrow.
Okay, so we have Friday off?
We don't have Friday off. Sure. Nice try. Hang on one sec, Mike. And then after that, we'll meet with Erin about the agenda. So we're just meeting it a little later tomorrow for that. Mike?
Based on our original schedule for tomorrow, I had made an appointment with the Secretary of State at 8:30. since she doesn't have to wait for the governor's address to talk about her budget.
Yes,
So I should be here. I mean, we're gonna meet in the building, but I'm a little late probably.
that's perfectly fine. Liquor lottery is not yours. I
Yeah.
can't remember whose that is. Is it Jim? Is it Jim?
Yeah.
Jim will be here.
Basketball pools included.
He's all about sin.
Gambling.
Okay. So we're gonna meet at 9. I know, that's why.